had the honor to work alongside Dr. Charles Blair with Practice Booster Insurance Solutions newsletter, assisting many team members just like yourself in solving their most complex coding and insurance challenges. I also was able to contribute to many of his resources for the 7-year period that I was with Dr. Blair. So I love educating dental teams on coding and insurance and proper best practices in regards to that topic. One of my favorite topics is Medicare. So Medicare is changing and Medicare does apply to dentists. So today, while our time is limited, we are going to review some Medicare basics. Hopefully what you learned today will help you navigate some of your challenges. Due to time, we may not get to have a long Q&A sessions, but if you'll enter your Q&A, your questions in the Q&A box, Stephanie will make sure I receive those questions and your question will be answered, perhaps post-webinar today. So again, thank you for joining me. And it looks like Steph has joined us. So welcome, Steph. I'm glad that you were able to log back in. Technology is great when it works well, right? And you recovered very nicely, Steph.
Thank you. I'm so sorry about that.
Did you have anything to add? I did, I'm thrilled to partner with Wisdom to offer this educational opportunity. And thank you for asking me to share my passion.
Thank you for being here. And no, I think you covered it all. Anything we don't cover today, again, will be included in our follow-up email that will go out before the end of the week, and we'll make sure we get everybody taken care of.
Okay, awesome. All right, let's go. Let's talk about some Medicare. First, a few disclaimers. Always have those disclaimers, right? The information presented is intended for educational and training purposes only. It is not intended to be legal advice. I am not a licensed attorney. For any legal related questions, you should contact a healthcare attorney knowledgeable of your state healthcare laws, dental PPO contracts, because dental PPO contracts work very differently than medical, and knowledgeable of Medicare and how it applies to dentistry. The information presented has been thoroughly researched and is current as of today's date. So you may be wondering, did she really make sure it's current as of today? Yes, I did. Medicare is changing rapidly. So anytime I present on Medicare, there are a few things I do go out to cms.gov and check just to make sure that nothing has changed. So it does change quickly. Medicare billing and dentistry. So today, hopefully you'll gain some insight on Medicare and how it applies to your dental practice. Let's start out by defining and, discovering who are our Medicare patients. Well, when we talk about Medicare, the Medicare patient is referred to as a beneficiary of Medicare program, Medicare benefits, Medicare reimbursement. So they are the beneficiary. Our Medicare patients are age 65 and older. Everyone who turns 65 becomes eligible for Medicare. Also, patients with end-stage renal failure. So your patients who are on dialysis or have had a kidney transplant or on the transplant list, these patients qualify and meet the requirements to be on Medicare. Permanently disabled patients receiving Social Security disability benefits. My husband's been on Medicare since he was 46 years old. So, age, you cannot assume just because the person's not 65 that they don't have Medicare. Patients with ALS also receive Medicare. Let's talk about that savvy patient. So our Medicare patients are very savvy. First of all, we're living a little longer and we're pretty smart. As a Medicare patient, we're very smart. We know the Medicare rules, and the savvy Medicare patient will file a claim. They understand what you can and can't do. Sometimes they're more savvy than we are. So we've got to step up our game and learn all that we can about Medicare and how it applies in our practice. So we're going to start out by talking about original Medicare. So we have original Medicare, we have Medicare Advantage, but we're going to begin with original Medicare. It used to be referred to as traditional Medicare, and CMS has changed that language to reflect original Medicare. This is an example of an original Medicare ID card. So when you ask the patient for their medical insurance card, which I hope many of you have implemented in your practice, you should be asking for their medical and their dental card, because you never know when you're going to need that medical plan information, because many of our medical plans have coverage for dental. So your patient, your Medicare patient, may present this red, white, and blue card. Every patient that becomes eligible and enrolls in Medicare, regardless if they choose a Medicare Advantage plan, will receive this original Medicare ID card. Sometimes the original Medicare patient, they may present with this commercial card, commercial payer card. This is called a Medigap plan. So if a patient, when they become eligible to enroll in Medicare, elects original Medicare, $140 or whatever it is currently is going to be taken out of their Social Security check to pay for their original Medicare. Original Medicare will pay 80% of a covered Medicare service. The patient is responsible for 20% of what original Medicare does not cover. Some patients with original Medicare purchase this Medigap plan. It's referred to as a Medicare supplement insurance plan. Supplement is a key word here. So they purchase it from the commercial payer. The supplement or Medigap plan takes care of the patient's 20% responsibility that original Medicare will not cover. So if a patient presents with this red, white, and blue card and an original Medicare Medigap supplement card like you see on the screen, that means they have original Medicare. So let's talk about the 4 parts of Medicare. We have Part A, which is their hospitalization coverage. A dentist is never, ever, ever going to enroll as a Part A provider or bill Part A. This is strictly for hospitals. So even if your provider goes to the hospital to see a Medicare patient, they're not going to fall to Part A. They're not Part A providers. Where do we fall into that? We fall under Part B of Medicare. So that's where the outpatient services or our services, professional services, come into play with Medicare. So again, even if your doctor goes to the hospital to see a patient and they happen to be enrolled properly to file a claim, they're going to file Part B. So that's where dentists come into play. Also under Part B is your durable medical equipment. So while it's a separate enrollment and a separate billing process, DME actually does fall under Part A of the Part B of the Medicare program. I apologize. Then we have Part C. Part C applies to dentistry. Part C is your Medicare Advantage plans. And we'll talk about Medicare Advantage towards the end of the presentation. Part D, a dentist will never enroll as a Part D provider nor file claims to Part D. This is the patient's prescription drug program, and a pharmacy is going to file and enroll as Part D. So with basic Medicare, original Medicare, Medicare has divided up and assigned geographic jurisdictions by your location, by your state. And what is that? That's called a MAC. It's called a Medicare Administrative Contractor. And your state has assigned you a MAC. So what do you need to know about your MAC? First of all, you need to make friends with your MAC. That's where you're going to find so much education. That's where you're going to find enrollment when your doctor chooses to enroll or opt out in Medicare, which we're going to talk about in a moment. You're going to need to know who your MAC is, because they're responsible for accepting those applications, processing them, enrollment applications and links to how to enroll, and great information can be found on your MAC's website. They also offer training. So many of our MACs have training specific to dentistry. So again, I encourage you to make friends with your MAC, know their website, just such good information. You're also going to find any Medicare forms, fee schedules, because it's federal funded. You're going to find fee schedules. The fee is going to be open to the public. You're going to be able to locate those fee schedules. They also have what they call local coverage determinations. So in your geographic location, they're going to give you guidelines to determine if a service is covered. There's so much there. While you're assigned a certain MAC, it doesn't mean that you cannot go out to other MAC sites. Some of the MACs have more education or different educational opportunities than one. So for education, certainly you can visit some of the other MAC sites. And I encourage you to do that, to educate yourself on Medicare. I mentioned enrollment. So when we talk about enrollment, is your doctor enrolled or opted out of Medicare? Let me first clarify. There's no such thing as opting into Medicare. Your doctor has either chosen to enroll with Medicare or opt out when we talk about the enrollment piece of it. So they actually have 5 options. There's only 4 listed on the screen, right? So again, we fall under Part B under Original Medicare. So enrollment means that as a Part B provider, you have 5 options. What's that 5th option? Let's start there. You can continue to ignore Medicare as a provider, or you can enroll, or you can opt out. Now, each choice has consequences and implications and rules that go along with it. Even if your doctor elects to not do anything with Medicare, they don't want to enroll and they don't want to opt out. You need to know what that status means for your practice as a team member, and your doctor needs to understand what that means. So that's still an option. Is it a valid option or a good option today for most dentists? Probably not. So what are the other enrollment options as a Part B individual provider? The options are your doctor can elect to enroll as an ordering and referring provider. So what does that mean? It just means that your doctor is going to tell Medicare, I would like to order tests for my patients and refer patients for additional treatment for covered Medicare services. It doesn't mean that your doctor can bill Medicare, your doctor can't file a claim, but what it does is it makes them eligible to order that pathology report. That means they can send the tissue sample to a pathology lab, and that pathology lab can bill Medicare and they can be paid. As an ordering and referring provider, that's what that means. You're eligible to order and refer patients for covered Medicare services, which allows that subsequent provider to be paid for those services by Medicare. Your doctor can also elect to enroll as a Part B provider of services. Maybe your doctor does provide a lot of covered Medicare services, such as biopsies or TMJ evaluations, and your doctor says, I want to be paid by Medicare for these covered services, so I'm going to enroll as a Part B billing provider. And your doctor is then subject to all of the billing rules and regulations and must file claims, and is eligible to file a claim to Part B of the Medicare program. Your doctor can also decide, I want to opt out of Medicare. What does it mean to be opted out? It means that your doctor submits an affidavit to Medicare stating, I want to opt out of Original Medicare, and I want to be able to charge my patients for these covered Medicare services like a biopsy. And in order to do that, I agree that my patient cannot file a claim, and I cannot file a claim for a covered Medicare service, and I'm going to enter into a written private contract as an opted out provider with every Medicare patient. That is critical to understand what it means to opt out. Often I hear team members, or in a lecture or a presentation, I'll ask, do you know what your Medicare status is, either as a provider I'm speaking with or a team member? And sometimes they just say, oh, we're opted out. We don't do anything with Medicare. And I'll go and check an opt-out list to double check and see if that provider has a valid affidavit on file. oftentimes they don't show up on that list. So it's important for all team members to understand what opt-out means. Again, it means that your doctor has submitted an affidavit to Medicare indicating, I want to opt out of original Medicare, and I agree to enter into those private contracts with the patients. You can only enter into a private contract if your provider is opted out of Medicare. Then we have DME, durable medical equipment supplier. So if you're providing obstructive sleep apnea appliances, those oral appliances to treat obstructive sleep apnea or OSA, that's a covered Medicare service. Your practice must enroll as a supplier. The other enrollment options and opt-out option we've discussed thus far is for your individual provider under their NPI Type 1. And each individual provider should make their own choice. So you could have 4 providers in your practice, and each one of them choose a different enrollment or opt-out option. But a DME supplier means that you're enrolling your practice, you're in practice TIN, your billing entity under their NPI Type 2, and you're telling Medicare, I want to offer this appliance and I need to bill Medicare for this appliance, and I want to become the supplier. So your practice essentially becomes the supply store, just like the store down the street that rents and sells canes, walkers, and wheelchairs. That's durable medical equipment. The durable medical equipment known as DME that you're supplying is that oral appliance to treat OSA. So these are the 4 options that we have for Part B enrollment for each provider and your practice. So how does Medicare affect dentists? There are 4 very specific areas in which dentists are affected by Medicare. I mentioned ordering and referring requirements. So the ordering and referring requirement ruling has been in place since January of 2014. So you see, Medicare is not new to dentistry. This ruling came into play when it says, in order for that provider, that pathology lab, to be eligible to file that claim and be paid by Medicare for their services, the referring doctor or the ordering doctor must be eligible to order that test. So, or enrolling as an ordering and referring provider enables that provider to be eligible to order that test and the subsequent provider to be paid. Now, what it doesn't mean is you cannot bill for those covered Medicare services. You also cannot charge for that biopsy. So if you remove the tissue sample and your doctor elects to enroll as an ordering and referring, that biopsy is a covered Medicare service. And we'll learn why in just a moment, that you cannot charge the patient for the biopsy. You can do the biopsy. You can also send that tissue sample to the pathology lab for an evaluation and a diagnosis, and that pathology lab will be paid. Next is the mandatory filing law. The mandatory filing law has been in place since September 1st, 1990. So you see, while in dentistry, we like to think, oh, Medicare doesn't apply to us. Yes, it does, and it has for a very long time. So we'll talk a little bit more in detail what that mandatory filing law means to you and your practice. And then we have Part C of Medicare. That's where Medicare Advantage plans come into play. A recent study revealed that more than 53% of all Medicare patients have elected to purchase a Medicare Advantage plan. Many of these Medicare Advantage plans include supplemental dental benefits, and we're receiving a lot of calls, and many of our patients have these supplemental dental benefits. So it does affect dentistry. And then, of course, the reimbursement for oral sleep appliances. So what about that mandatory filing law? Medicare monitors compliance of this mandatory filing law. So what the mandatory filing law says is, if you provide a covered Medicare service, such as a biopsy, under this ruling, you're required to submit a claim to Medicare. However, you're only eligible and can only submit a claim to Medicare if you're enrolled as a Part B billing provider. So what does that mean? It means that if you provide a covered service, you can't bill the patient for that service because you can't file a claim because it's a covered Medicare service. Only if you're opted out of original Medicare and have entered into that private contract could you bill the patient for that biopsy. If you're only enrolled as an ordering and referring, you can't bill the patient because that's one of the exceptions is when you provide that service for free, that's an exception to the mandatory filing law. So the violation of this law carries a penalty of up to $2,000 per violation. And continued violations may be punished as a misdemeanor, resulting in additional fines and possible jail time. So let's look at a scenario. Remember, I mentioned that savvy Medicare patient. Your provider is enrolled as an ordering and referring provider. You do a biopsy, you bill the patient, and the patient pays $100 for that biopsy. That savvy Medicare patient is going to go home and talk to their neighbor who says, oh, well, I didn't have to pay for my biopsy. Medicare paid for my biopsy. You should file a claim. So that savvy Medicare patient is going to file a claim. And Medicare is going to look at your provider's NPI type 1 and look and see, oh, well, they're not enrolled as a Part B billing provider or opted out. You may then get a call and or a letter stating you're required to file this covered Medicare service. In order to do so, you must be a Part B billing provider. Sometimes that letter goes on to state the patient is not responsible for this charge. You should issue a refund to the patient. If you get one of those letters, that means someone has filed a claim and you may be subject to that $2,000 per incident violation fine, and you may have just opened yourself up for an audit. So it's important to understand this mandatory filing law and how just enrolling as an ordering and referring, it's easy to violate this law unknowingly because again, your patients are very, very savvy. They know how to file those claims and they're going to try to get that coverage. If you're opted out, again, you will have entered into a private contract with the patient, telling the patient, I'm opted out, I'm providing this biopsy, it's a covered Medicare service. Under my opt-out agreement, you cannot file a claim, I cannot file a claim, and you agree to pay my fee. So in that instance, you could charge that $100 fee to the patient if you're opted out. So you see, simply informing patients that the practice does not accept Medicare, does not file claims to Medicare, does not relieve a provider of the requirement to file Medicare claims and risk violating this mandatory filing law. So I mentioned there was some exceptions to the mandatory filing law. What are those? Well, the first one is used durable medical equipment purchased from a private source. Hopefully, we're never going to provide a used sleep appliance, right? So this really won't come into play for us. Medicare is secondary payer claims when you do not possess the information required to file a claim. Foreign claims. The last three on this list apply to dentistry most often. Services furnished by opted out physicians, except in the emergency situation. So I mentioned that. Again, if your provider has a valid affidavit on file with Medicare stating I'm opted out, then again, the private contract comes into play and you must enter into that. And this is an exception. You could charge the patient for the biopsy and you're not required to file that claim. Services that are furnished for free is an exception to that ruling. That's why if you're only enrolled as an ordering and referring physician, then you can't bill the patient for that biopsy. You can't charge the patient, and that is an exception to the mandatory filing law. The last one is services that are statutorily excluded by Medicare. So some services are statutorily excluded by Medicare, such as a routine pro fee. That would be an example of an exclusion that's statutorily excluded by Medicare. You could provide that pro fee and it's not covered under original Medicare. Therefore, there's no restrictions and there's no requirement to file that claim for that pro fee. So what are covered Medicare services? There's no list I can direct you to that outlines it specifically, but here are some of the most common services that we provide in dentistry that are covered by original Medicare. Your oral biopsies, cancer treatments, TMJ evaluations, and some TMJ treatments, including surgery. Your occlusal orthotic devices are not currently covered under original Medicare, but that TMJ evaluation, that is a covered Medicare service. Trauma such as jaw fractures. Now, Medicare is going to pay to repair that fractured jaw. They will not pay to replace the teeth as a result of that fractured jaw or the dentures. Anything above the mandible or the maxilla, they're not going to cover for that. Medically necessary dental treatment as defined under the expanded dental benefits. So we're going to talk briefly about that and how it's affecting dentistry. Oil appliances for sleep apnea, which we've covered. So the statement of exclusion. So let's go back to that under original Medicare. It states dental services in connection with the care, treatment, filling, removal, or replacement of teeth or structures directly supporting the teeth, except for inpatient hospital services in connection with such dental procedures. When hospitalization is required because of the individual's underlying medical condition and clinical status or the severity of the dental procedures. So that's the statement of exclusion under the federal ruling for Medicare. So when I mentioned that Medicare will cover repair of the fractured mandible, but they will not cover the replacement of those teeth or the dentures. But what's changed with that exclusion? Effective January 1st, 2023, an amendment to this regulation was made. It states, in order for Medicare payment to be made, the dental services must be inextricably linked to and substantially related and integral to the clinical success of certain other covered medical services. So what does that mean? So before we move to Medicare Advantage, let's expand on this a little bit. What that means is there have been changes, and this ruling has been clarified, and it's known as the expanded dental benefits. For example, effective January 1st, 2023, the workup, the diagnostics, the evaluation that's necessary prior to any organ transplant, including dental treatment, to rid the patient of infection is now a covered service under Medicare when it can be inextricably linked to and relates substantially to the success of that organ transplant. Prior to 2023, that stated only inpatient services. It did not include treatment. It only included the workup, the evaluation, and any diagnostics included as part of that request from the transplant surgeon. It also only applied to kidney transplants. Well, now it applies to all outpatient services, including the workup and dental treatment prior to any organ transplant, not just kidney transplants, including stem cell transplants. Prior to 2023, it also stated prior to any cardiac valve replacement. That has not changed. So this applies, and it also affects treatment. Some of that treatment may be your scaling and root planing prior to that organ transplant or prior to that cardiac valve replacement. Those are now covered dental services under original Medicare. In 2024, that expansion was further defined to oral cancer treatment. So if you're doing a workup and you're providing treatment for this oral cancer patient, some of those services may be covered under original Medicare now. So it's expanding, it's changing quickly. There's also a proposed ruling for 2025 that's going to affect dentistry. So it's important to learn how to use your resources to Medicare, stay up to date on what's happening with those expanded dental benefits and how it's defined so that you're aware. First, understand your provider enrollment option, how it affects your practice, what services you're providing, understanding the mandatory filing law so that you're not violating that law. If you find that you're providing this workup and treatment prior to an organ transplant, you need to know what that provider enrollment is and if you can charge for those services so that you don't risk violating the mandatory filing law. So that is very brief explanation of original Medicare, how it affects dentistry, and some of the changes that have occurred the last couple of years with the expanded dental benefits, how it affects your practice, and the proposed ruling for 2025. It is there. It should be finalized. I usually start reading that final ruling in November to determine how it's going to affect dentistry. But yes, original Medicare does affect dentistry, and we need to be aware of how it affects and applies in our individual practices. So I mentioned Medicare Advantage. Many of you probably came here today thinking Medicare Advantage drives me crazy. I just can't figure it out. Again, it's Part C of the overall Medicare program. Many of these Medicare Advantage plans have a lot of great dental benefits, and we don't want to miss out on that revenue, right? So let's learn a little bit about Medicare Advantage, Part C of the Medicare program. So Medicare Advantage, whenever a patient becomes eligible to enroll with Medicare, they can either elect to enroll with original Medicare, and maybe they choose to purchase one of those Medigap plans we mentioned. They don't have to, but some do. But some patients prefer to purchase a Medicare Advantage plan instead of just original Medicare. So we call these replacement plans sometimes. You may hear that language. Medicare Advantage is a replacement plan for original Medicare. And they're sold by commercial payers such as Aetna, Blue Cross, Humana. These are medical plans that fall under the oversight of the Centers for Medicaid and Medicare Services, CMS. And there's a contract between CMS and Blue Cross Blue Shield that says, I'm going to allow you to sell this Medicare Advantage medical plan. And I'm going to pay you a portion of the $140, whatever the amount is, that's deducted from this Medicare patient's Social Security check. In exchange, you, Blue Cross, agree under this medical Medicare Advantage plan to at least offer what's covered under original Medicare, such as your biopsies, and that falls under the medical piece of it. But I'm also going to allow you, Blue Cross, to have supplemental dental benefits or supplemental benefits as part of this medical plan. That's where you come into play. The dental benefits, the supplemental dental benefits. It's not a basic benefit like biopsy that falls under original Medicare, but it's known as supplemental. Also, in addition to dental, this is where the Medicare patient's going to receive their hearing benefits. The Medicare Advantage plan under supplemental may cover a portion of their hearing aids. Vision benefits as well. That's supplemental benefit of a Medicare Advantage plan. Your Silver Sneakers program, the fitness and healthy living programs is supplemental and part of this Medicare Advantage plan, meaning that if the patient elects a plan with supplemental fitness benefits, they can enroll with a participating health plan, gym or fitness center, and their Medicare Advantage plan will pay a portion of their monthly membership fee. So you can see, in addition to the supplemental dental, this is very enticing for the Medicare Advantage plan patient to purchase an Advantage plan, because many of our Medicare patients have never had these supplemental benefits before. So, and they're very rich with benefits, especially the dental piece. In some areas, some of the plans have $3,000 annual maximum for these supplemental dental benefits. So yes, we want to capture that revenue, right? We don't want to turn away these patients. This is the sample Aetna Medicare Advantage card, one of the things I hear is, how do I know the difference? So we already learned if the patient only has original Medicare and or a Medigap card, we looked at some sample cards for that. So one of the things I want to point out is, and I pick on my husband about this, and I'll use him as an example. He elected a Medicare Advantage plan from Blue Cross Blue Shield. So when he became enrolled with Medicare, he received that red, white, and blue card, but he also received a Blue Cross Blue Shield Medicare Advantage card. And he would get so confused, and your patients are going to get confused. So it's possible that, like my husband, your patient's going to give you a red, white, and blue card and a Medicare Advantage card. And you need to know the difference there because they don't. For my husband, I finally said, give me that red, white, and blue card. You no longer need that. And I hid it from him. But many of your patients are going to give you everything they have in their wallet. So it's up to us to learn to tell the difference in the different types of Medicare. So how do I know this Aetna plan is a Medicare Advantage medical plan? HMO and PPO. When you see Medicare HMO or Medicare PPO, that tells you that this Medicare patient does not have original Medicare, that they have this Aetna Medicare Advantage medical plan. And underneath, you'll see Aetna Medicare Dental. That tells you that they have elected a Medicare Advantage medical plan with supplemental dental benefits offered through Aetna. So that's a given that this is a Medicare Advantage plan. This is an example of a Humana. Don't we all love Humana Medicare? It's a lot to navigate. They have a lot of plans. They're very strong in the marketplace selling these plans. Well, again, the key word here or key is Humana Gold Plus HMO. That tells me this is a Medicare Advantage plan. And on the back of this card, it'll say additional benefits. When you see DEN and 3 numbers, that tells you this patient has elected to purchase a Medicare Advantage medical plan. And also they have supplemental dental. VIS means that they have supplemental vision. HER means that they've elected a plan with hearing supplemental benefits. So this is the difference between the different types of Medicare. I mentioned earlier when I said keyword was supplement. When we talk about supplement, that typically on that card is going to give you an indication that it's a Medigap plan, that it's not Medicare Advantage. But whenever you see the word supplemental, that tells you when you confirm those benefits that it's Medicare Advantage plan typically. So those are some key phrases to know when you're trying to distinguish the difference between original Medicare, the Medigap card, and the Medicare Advantage card. So what do you need to know about the Medicare Advantage plans? So first of all, as of January 1st, 2022, Medicare clarified an existing ruling. Prior to that, we had many dental payers who had providers who had opted out of original Medicare. They were not being paid by these Medicare Advantage plans, even for the supplemental dental benefits. And it's because the ruling says that a Medicare, the ruling says that a provider who is opted out of original Medicare is not eligible to receive benefits from a Medicare Advantage plan, regardless of who those benefits are paid to, whether it be the patient or the provider. But it doesn't apply to supplemental dental benefits. It only applies to basic services, such as your biopsies or your services that are covered under original Medicare. So in 2022, Medicare clarified that ruling and how it applies to those supplemental dental benefits. So what does that mean? It means that as if your doctor elected to opt out of original Medicare, you can be paid under that Medicare Advantage for those supplemental dental benefits. So it was a great clarification that Medicare has made. And when I talk about clarifying all of these rulings, that's one of the things that's changing rapidly. So Medicare has realized that we as dental providers are providing covered Medicare services. So each year they clarify more and more of these rulings. That's why it's important to understand some of the basics of Medicare and keep up with what's happening in Medicare as it applies to us. So even though Medicare clarified this ruling in 2022, some Medicare Advantage plans may not offer out-of-network benefits, meaning they may require you to enroll as a participating provider with their Medicare Advantage network to receive reimbursement and file for these supplemental dental benefits. Some of these commercial payers, such as Blue Cross, Humana, and Aetna, who are selling these Medicare Advantage plans or who administer the Medicare Advantage supplemental dental piece on behalf of that Medicare Advantage medical plan, even though this ruling has been clarified, some of them now are beginning to state, if your doctor has opted out of original Medicare, we may not let you in as a participating provider with our Medicare Advantage network. So I wanted to make you aware of that. I am seeing a couple of payers here and there apply that, and they have the leeway under their contract with CMS to make that requirement. So some of these Medicare Advantage plans do have out-of-network benefits. Some of them only have benefits whenever the patient chooses to seek dental treatment from a provider who is enrolled with that payer for their Medicare Advantage network. Some of your dental PPO contracts may automatically enroll you in their Medicare Advantage network, while others, it may be a separate enrollment process. And typically, they may have an opt-out option for you. So plans benefits vary greatly as well. So it's all over the place. Medicare says that if you want to bill to these Medicare Advantage plans for supplemental dental and be paid by them, you need to follow the payer requirements for billing and receiving payment. And it does vary. Is it possible to learn what those variances are? Absolutely. Just as we in dentistry have come to know what some of our dental payers require and their processes, we need to become familiar with these Medicare Advantage plans and what their payer processes are if you would like to bill for these services and be paid. Excuse me. One such requirement that you may or may not be aware of is some of these payers, in order to receive reimbursement for the supplemental dental benefits offered under the Advantage plan, you may be required to submit a predetermination, especially for the basic and major services. You need to know what that requirement is, because there are sometimes if you don't follow that requirement, you can't be paid for that service. Sometimes it means you may not be able to bill the patient for that service. So you need to know what these requirements are, including a predetermination requirement. Get to know your payers, get to know your plans, and understand their processes. Again, it's no different than understanding our dental payers' processes and what they require. Some plans are standalone dental plans. So what does that mean? So it means that if my husband purchases a Medicare Advantage medical plan without any supplemental dental benefits, that makes him eligible to purchase a standalone Medicare Advantage plan, maybe from AARP, for example. It could be standalone and it may not be subject to some of these Medicare regulations because it is not part of the Medicare Advantage medical plan. So just know that. I don't see a lot of standalone Medicare Advantage dental plans being sold any longer, because most of our dental payers who are only administering the dental benefits have engaged with medical payers offering the medical piece of it, and they're contracted to offer and administer the network, administer the claims, and the supplemental dental benefits. So again, I'm not seeing a lot any longer, but I wanted to make you aware that it is possible. It's a standalone dental plan. It's critical that you understand the guidelines. for these Medicare beneficiaries under the Medicare Advantage. Know your payers. So that concludes the educational piece of our content today. Again, it was very, very, very basic information about original Medicare, the parts of Medicare, and a little bit about Medicare Advantage. There's a lot to know about Medicare. A comprehensive workshop on Medicare tends to last 3.5, 4 hours when I offer them. I do offer customized training for your team and how your provider's enrollment option may apply to your practice and what you as dental team members need to know to help your doctor ensure that he or she is compliant. One of the things you need to understand whenever you go to cms.gov, which is the provider site, and you start educating yourself on Medicare, Medicare has made it very, very clear. Whenever you see the term provider or physician or supplier, it applies to dentistry. So whenever it says this ruling applies to all physicians, that includes a dentist. They've even taken a step further in the past few years. If your doctor were to go to enroll as an ordering and referring or Part B provider of service, it used to be they were an other unless they were an oral surgeon. But now we have our own category as a dentist. So you see, Medicare is aware that we exist and we're providing covered Medicare services. And again, each year they're clarifying many of the existing rulings and amending some rulings. And it applies to dentistry and they're clarifying exactly how does it apply. So go find your MAC. In your follow-up email, staff's going to send you a link of how you can find your MAC. Now, MACs can change on an annual basis. Typically, the MACs will change in June or July. So I'm going to supply you with a link to the current list. Again, know your MACs. If you're Medicare Advantage, understand those Medicare Advantage payers as it applies to supplemental dental. Get to know their processes and requirements. Thank you so much for joining me for this Medicare webinar and learning a little bit about the basics of Medicare and how it applies. Thank you so much, Stephanie and Wisdom, for asking me to present today.